Hi, my name is Danielle and I'm a physical therapist, and I'm going to talk to you today about bladders behaving badly. And it's what we as physical therapists do to help people suffering with incontinence. So what is incontinence? Incontinence is an involuntary loss of urine, meaning you go to the bathroom when you were not planning on going to the bathroom. Super common, affects 25 million people of all ages. Half of all women and 20% of all men will experience incontinence at some point in their lifetime. Super common with pregnancy. Women are used to this. 80% of women will experience it during pregnancy. Women have a 20% chance of having incontinence per child. 5 children, 100% chance. Incontinence is not an inevitable result of aging, and that's what I really want to focus on here. It's not just because we're getting older. Incontinence is not normal, and it shouldn't be tolerated, so we should try to see what we can do to improve it. Again, a couple more facts. It's not a disease. Only half of people even discuss it with their doctor. I just noticed on one of my slides it says 1/12 of people discuss it with their doctor. It's really half. I'm going to have to edit that. On average, a woman waits 7 to 9 years to seek help. It's associated with nursing home admissions because people feel like they can't care for themselves at home, or their loved ones feel like they can't. That's like the deal breaker. So we definitely want to get it under control if we can. 80% of cases can be improved, and that's what I really want to bring home today with this discussion. Treatment depends on the type of incontinence you have, and there are several different types that we will discuss today. Most treatments involve a combination of pelvic floor muscle exercises. I know a lot of you are going to say, I've tried the Kegels, they don't work. Well, there's more to it. Maybe you were one of the slim people that didn't need the Kegels, or you were not doing them correctly. And Kegels are difficult because you can't see them. Behavior modification, which I think is the hardest for people. There are a lot of absorbent products out there, and we want to talk about what kind to get, and sometimes medications. And I know people want to limit the medications they're on, but there are some that can be helpful for some types of incontinence, not all. In updating this presentation, I found myself spending a lot of time on the National Association for Continence. I've got the website up here, the nafca.org. Great information. And since I updated this presentation last year, I'm getting all sorts of great email updates from them. Up there a little bit earlier, I talked about women wait 7 to 9 years to seek help. Often men don't seek help at all because they don't feel comfortable talking about it. And as women, we're used to menstruation, we're used to talking about those body parts a little bit more, but men and women are very much the same, surprisingly, when we talk about that part of the body. So let's talk a little bit about the anatomy and the physiology. So you can see on my picture here, we've got kidneys. It looks like a kidney bean, and that is where the urine is made. And then down below, we have the bladder, and that's just storage. That's where urine is stored. And then we have those ureters in the middle that kind of connect them together. So below that, we have a pelvic floor. So I'm going to be kind of showing you this model a lot today. And so everything on this little slide here is happening inside the pelvic floor, but the muscles are under voluntary control, and that'll be important moving forward. So the bladder. As I spoke about, the bladder is supposed to store urine until you want to go to the bathroom, and it's under voluntary control. So ideally, you would be notified that you wanted to go to the bathroom when the bladder is half full, and then you could make the decision, it's a good time, I'd kind of like to go to the bathroom right now, or oh, I'm at this point of the movie and I just want to watch it a little bit longer before I get up. And so we'll talk more about that, but that's normal to be notified when the bladder is half full. So coming back up with the model, those muscles are under voluntary control, meaning you are supposed to control them. So in the picture above, you can just see it's a total network of muscles. So from the inside, it's a basket. And men and women are the same if we're looking in this direction. So I'm going to try to angle this at the screen. And in this basket, so I'm going to go from the back side. So here's our spine. And then these are our hip bones. And then this comes down to our tailbone. If you follow the tailbone down, you're going to hit the anus. That's where the poop comes out. We can talk about that at another time. And then coming forward a little bit more is where the urine comes out. And I know boys and girls are different, but truly if we peel off everything, I know that sounds terrible, but we're all going to come down to this muscle. And it's really interesting, and I should have practiced with this screen a little bit, but these muscles make a figure 8. So they're all really connected. So some types of incontinence are associated with the muscles. Other types are associated with the bladder that's sitting inside, and they're not the same. So you have to have a treatment that is ideal for what you need. So let's go into the 4 types of incontinence that I'm going to discuss today. There's more than that, but these are definitely the top 4 that we talk about. Stress incontinence, it's not just stressful. I'll tell you what that is in a minute. Urge incontinence, I'm sure you can imagine it's that strong urge to go to the bathroom. Nocturia, which I'm probably pronouncing wrong, happens at night. And functional incontinence is really not about the bladder. It's about, can you get to the bathroom on time? And sometimes that's all the issue is completely. All right. I've got this picture of this man coughing with stress incontinence. Stress incontinence is the loss of urine with that increase in intra-abdominal pressure. So when we cough, when we sneeze, when we laugh, it causes a downward pressure on this pelvic floor. And if you don't have the strength, the urine's going to leak out this way. So that is stress incontinence. We also see it with a change of position. So if you're getting out of a chair and you're pushing down and there's that downward pressure on your pelvic floor, the urine can go out instead of maybe your breath going out. So this is definitely the weakness of the pelvic floor. Most people say with this type of incontinence, they leak a couple drops, maybe not enough to completely, soil their outerwear, but definitely enough that they feel it in their underwear or their panties. So if you think about Parkinson's disease, and I know that's something we're talking about today, well, we know Parkinson's affects every muscle in your body, whether we're talking about your voice, or we're talking about swallowing, we're talking about walking. Well, these are muscles, so definitely they can be affected by Parkinson's. So urge incontinence. I have the picture of the door here because this is that, oh my God, I'm driving home and I've got to go to the bathroom, and the closer you get to your house, you're like, oh my God, I am not going to make it. And then you put the key in the door and you just wet at the front door, or you're in the garage and it's not just a couple little drops. I'm talking shower time. You've got to change your underwear and your pants. So this is urge incontinence. And I'm going to read my slide to you. An involuntary loss of urine associated with that abrupt, strong urge to void. And the bladder, it contracts for no apparent reason. So I'm not talking about the muscles. I'm talking about the bladder that sits inside here. Again, usually wets your outerwear as compared to stress incontinence where it could just be a couple drops. It's really not from weakness of the pelvic floor, but it's from that bladder spasming. Hey, it would help if your muscles were strong enough to withhold that, but sometimes even the strongest person might not be able to. So typically, urge incontinence is from bladder irritants. And I think you guys can think about if you've had too much coffee, too much soda, a glass of wine, and you're having to go all the time. That's kind of a little key here, that those things are irritating to the bladder. And so urge incontinence responds to life changes. Another name for it, if you're looking at other literature out there, is overactive bladder. Urge incontinence and overactive bladder are used interchangeably. And urge incontinence is, in the literature, common with Parkinson's disease. But please understand, this incontinence is common with everybody, so I'm not trying to pin just another thing on your Parkinson's disease. This is just another part of our body that needs to be addressed. So, nocturia, which was something I learned about on the National Association for Incontinence website when I was preparing this lecture a year ago to give at a Parkinson's symposium. I was not familiar with it. So what it is frequent nighttime trips to the bathroom, and there is an actual overproduction of urine at night. Women, of course, due to childbirth, menopause, or pelvic organ prolapse, which I'll touch on at the very end. Men can be due to an enlarged prostate. It's not prostrate with an R, folks. It's prostate. And then BPH, benign, I'm not going to be able to pronounce this right, prostatic hyperplasia. It is common with Parkinson's disease, and that is why I uncovered it preparing for my last lecture. You can train some behavioral patterns. The bladder irritants, which I'm going to bring up in minutes, can be helpful for this. And reducing the fluids at night, because you are producing excessive fluids before bedtime. Diminished nocturnal bladder capacity, meaning you can't hold as much urine at night. It's not just common with Parkinson's, it's common with diabetes, high blood pressure, congestive heart failure, vascular disease, sleep disorders, and insomnia. Functional incontinence. This is about the only place I'm going to talk about it. This is, you cannot get to the bathroom in time due to your mobility. And yes, this could be from Parkinson's. It can be from not doing enough exercise, because we know exercise is the key to living a successful life with Parkinson's. So you can improve your functional incontinence if that's the problem with exercise. Practice getting out of a chair. Remember to scoot to the front of the chair and explode up to stand up. Push down. If you're having some of that stress incontinence when you stand up, work on blowing out when you go to stand up. So the air's got to go somewhere. So if you're straining to get up, have the air go out your mouth instead of into your intra-abdominal cavity, which is going to push down on that pelvic floor and make you leak urine. But overall, we got to get active. We got to go to exercise classes. If you need a cane or a walker for those short distances, you've got to stay active so that you can control getting up in time when you need to go to the bathroom. All right, let's talk about the primary treatment for stress incontinence, and that is the Kegel exercise. First, you must find your pelvic floor muscles. And I'm going to bring the model in and out a little bit. So, your stomach, not the pelvic floor. Your inner thighs, they attach here on these sit bones, we call them. And your butt cheeks, they would be right here all filled in, except you guys, you have no butts, I've noticed. But those muscles are not the pelvic floor. The pelvic floor is just right here. This little figure eight of muscles under my hand right here, whether you're a boy or girl, it is the same. So we have to figure out how to isolate them. So I have the picture of the elevator. And the reason I have the picture of the elevator is you're in an elevator and there's one other person in the elevator and you have to pass gas. And you don't want them to know it's you that passes gas, right? So what are you going to do? You are actually going to pull up and in on your pelvic floor muscles to try not to embarrass yourself by passing gas. And that gas is coming from right here, which is the anus, which is really the same muscles as the pelvic floor because it is the pelvic floor. But look at how close it is. And I know this is the vagina here, and so I'm not talking but with men, again, it's in the same place. And then up from here is our urethra. And in women, that's where the urine comes out. So I always think about if you're trying not to pass gas or you're trying to do your Kegel exercise, I think we're all more familiar with the anus and what it feels like. Right now, I'm doing a pelvic floor contraction. You guys should be doing it too. So I'm pulling in, up and in around my anus to try not to pass gas during this lecture. Then I'm gonna pull forward, almost like I'm doing a zipper, up and in, pulling in the pelvic floor. That's your Kegel. I hope that made sense to you, and I'll probably go back to that a little bit. So I'm checking my slide to make sure I haven't missed anything. So, oh yes, I have. So with women, it's like if you had a tampon in and you felt like it was gonna come out and you were like trying to pull it up and in. Men, you guys can just stand in the mirror and try a Kegel, and you should see your whole penis package elevate a little bit, and that is where the Kegel exercise, that's the Kegel. Kegel, Kegel, tomato, tomato, but what we're trying to do is strengthen the pelvic floor. All right, so there are two types of Kegel exercises. We call it exercising your bottom line. So if you think about a baseball pitcher, they have to learn how to throw a ball very fast. So if I were training baseball players, which I never will be, but if I were, I would have them do a lot of fast exercises. Versus if I was training a ballerina, she or he has to sustain that contraction all day long. And so truly in your body, we have some of our muscles are fast twitch, some are slow twitch, and we're trying to work them both. The pelvic floor is 50-50, so we need to strengthen both ways. So we have 50% of them are those long holds that have to hold and make you continent all day. Hold that in. Plus, if you look at the orientation of your spine, we have the back muscles, we have the butt muscles, we have the stomach muscles, and we have the pelvic floor. This actually has a lot to do with your core stability. We call it force closure. And so those are those endurance exercises where you have to hold it. Where most people, when I meet them and they've started doing Kegel exercises, they're just doing them really quick because we're Americans and we just want to do things quick and try to get it all over with instead of having a sustained contraction. But we need to do both, and I've got this written out for you next. So we like to say 60 Kegels a day keeps incontinence away. So half are quicks and half are longs. So a quick contraction would be pulling in, letting go, pulling in, letting go, pulling in, letting go. So you could do 10 in a row, 3 sets, rest a minute between each set. So you would pull in, let go, pull in, let go, pull in, let go. The long holds are you're trying to pull in and you're trying to pull in and hold it there, hold it there, hold it there. Now, if you're new to this, you're barely going to make 5 seconds, okay? But over time, we want to get that contraction up to 10 seconds. And whatever you're able to sustain for the contraction, the relaxation is twice the time. So if you're contracting for 10 seconds because you've been working on this for 2 months and you've really worked hard, then your relaxation would be 20. And ultimately, you're going to work towards doing 30 of those in a row. So 30 quicks, 30 long gets us to 60 Kegels a day, keeps incontinence away. But we want quality over quantity. I would say start with 20 and work up to the 60 over several months. It takes 2 months to change a muscle in your body, any muscle at all. So you have to give yourself some time. Also, it's best to start lying down. Gravity is not your friend. So when you're sitting here and I'm sitting in the chair trying to pull up and in, I have to pull up and in against gravity. Or, oh my God, I'm standing up. If I'm standing up, then all the muscles of my legs, which are going in to the sits bones here, they're working like crazy too. And then there's no way I'm going to isolate the pelvic floor. But if you're lying down on your back, and even better, your hips are up a little bit to maybe you've got pillows under your knee or you're kind of really, excuse me, reclined in your recliner, then you're more in an advantage. Excuse me. Women, if you're comfortable with this, if you put a finger inside the vagina, you're going to be able to feel your pelvic floor contraction. And it doesn't feel like this super, you know, like if someone's trying to pull your finger or something. It's just a gentle, gentle contraction. I'm starting to forget if I put this in this lecture, but there's something called the stop test where you sit on the toilet and you stop the flow of urine. Yes, that is your Kegel muscle. So your pelvic floor. So if you do sit on the toilet and you try to go to the bathroom and you try to slow the urine or stop the urine, rest assured that is your Kegel contraction. And you can use that about once a month to test it, but that is not where I want you to exercise. And the reason is when we were like 1, 2 years old, we got potty trained and we learned when you sit on the toilet, you sit on the toilet and the bladder's supposed to contract, pelvic floor muscles open, and you pee. Well, now's not the time in your life to teach yourself that when you sit on the toilet, you want everything to shut down. So you can use that stop test to just know, am I in the right place? Because remember, you want to keep your tummy quiet, your big butt cheeks quiet, and your inner thighs quiet. We want to focus on the pelvic floor. The standing position is very difficult, so that's something you would work up to over time in a few months if you're super consistent. All right, so try not to hold your breath. I think of a balloon, and if we fill up the balloon with air, like I go, and I'm trying to do a Kegel contraction, all the muscles, all the air in my abdomen is going down on my pelvic floor. At the same time, I'm trying to pull up. Well, I'm not that strong. And if you're listening to this lecture, you're probably not that strong either. So you need to coordinate where you're trying to either have a normal breath or you're trying to work on your exhale. So often in the beginning, I think it's quite great to do it while you're working on breathing. So we say you breathe in through your nose to smell the flowers, and then you exhale to blow out your birthday candles. And what you would do with your Kegel is when you are blowing out your birthday candles, you would be pulling up and in on the pelvic floor. And that would be more of an endurance contraction because remember the quick ones are, I don't want to say they're aggressive, but you're trying to be able to teach them, okay, I'm going to need you later when I have to go to the bathroom. I want to be able to contract very quickly like that baseball pitcher. Again, you might need to feel those muscles. 6 to 8 weeks to strengthen any muscle in your body. We like to say use it or lose it, and that's for, you know, everything we're working on here, whether we're talking about the bladder, the bowel, or our mobility, able to get out of a chair. And we want to hold that squeeze until after the sneeze, but this is only going to happen with practice. You're not going to be great at this tomorrow. It's going to take some work, but I know you're willing and able. All right. Changing gears to urge incontinence. Back to the key in the door, driving home. Oh my God, this horrible, I'm going to just have this, I've got to go to the bathroom right now, this urgency. This is that strong, abrupt urge, and you cannot get to the bathroom in time. It's more about the bladder and less about the pelvic floor. And you usually lose your entire bladder, wets your pants, the whole 9 yards. Lifestyle change is key. not necessarily Kegel exercises. Now, I'm not saying you shouldn't do your Kegel exercises. A strong muscle is a happy, healthy muscle, but it really is the bladder irritants. And also, urinary frequency contributes to urgency. And if you're going to the bathroom all the time because you're terrified you're going to have to go to the bathroom some more, then your bladder's like, oh, she doesn't want to hold the bladder until it's half full like we talked about earlier. She just wants me to get rid of it all right now. So we'll talk in a little bit about having a bladder diary to try to figure out what's going on with you, because we want to have a calm before the Kegel. Calm before the Kegel. So let's go over those bladder irritants. So sadly, coffee, tea, soda, even decaf, alcohol, chocolate, vinegar, which is all the salad dressings, all the acid we love, nicotine, artificial sweeteners, acidic juices like orange, tomato, and even cranberry. And I know what you're saying. I thought cranberry was good for the bladder. Cranberry is good for the bladder if you have chronic bladder infections. But if your main problem is urgency and you don't have chronic bladder infections, cranberry is not for you. And you know what the biggest bladder irritant of all time is? Concentrated urine. So I'll take a sip of water on that so I don't cough again. It's very normal when you're struggling with incontinence to start restricting your water intake because you think if I don't drink, I'm not going to pee. But you know what happens is the urine is like dark and yellow and thick and smelly, and your bladder's not stupid. It wants to spasm the urine out so you don't have infections. So you have got to keep drinking water. You want your urine so clear that if you dropped a newspaper, I don't know if anyone gets the newspaper anymore, in the toilet, you could read it through there. So you do not want dark urine. Okay, so I know it's hard to give up coffee. And then if you're having trouble with constipation, that coffee is really helpful first thing in the morning, but you might want to think about when you're having your bladder irritants. Like, I'm not going to have them if I'm going out with friends, and you might restrict them to first thing in the morning when you can accept the fact that you might going to have that urgency and have to get to the bathroom quickly. All right, so controlling the urge to get to the bathroom dry. Your first instinct is to jump out of that chair and try to get to the bathroom as quickly as possible. Imagine what would happen if you were running with a full bowl of water. I have this vision of this crystal bowl that was at my house growing up. It wasn't Waterford, but it was something like that. And anyway, it's my vision. And if it was filled to the rim and you tried to run with it, it would spilleth over. So it's important when you're trying to get to the bathroom on time with this urgency, you're moving slowly. So what you actually need to do is stop, take a breath, and then do some of those quick Kegels. This isn't going to work tomorrow because you have not been practicing your quick Kegels yet. But once you're really good at them and you can isolate them because you've practiced them, those quick Kegels, they literally tell your brain, stop. I want to watch the end of this movie. Or hold on, I need to get my walker in front of me. Or, oh my God, I've already changed my pants 35 times today and I need everything to slow down. So, in summary, when you have the urge, you need to stop. You need to take a breath. You need to do a couple of quick Kegels. Then you need to slowly walk to the bathroom. And speaking of that, if you're thinking to yourself, I don't have a watch on, but if I did, it is not time to go to the bathroom. I just went to the bathroom. Then you need to have a little talk with yourself about, I'm going to do a couple quick Kegels so I can extend the time period between when I'm voiding, which we're going to talk about A little bit more with the bladder working. So back to the beginning. The bladder stores urine. A healthy bladder will notify you when it's half full. Urinary frequency becomes a problem when your bladder notifies you when it's a quarter full or even less. So these bad habits can even go back to childhood or pregnancy, not pregnancy, when you first bring your baby home and you get up to nurse at night, or those husbands out there, you get up with your wife to bring her the baby and you're like, oh, I'm up, I should pee. Well, guess what? You just trained your bladder that you like to get up at 3 a.m. because Timmy there always got up at 3 a.m. to feed or to have the diaper changed in the middle of the night. So we have to train ourselves out of that. The other thing we do is then Timmy grows up and we have the just in case. We call it a JIC, where we're like, honey, we're about to go to the store. Let's go to the bathroom just in case so we don't have to pee in the yucky store. And we all do this, especially when you're having incontinence, because you're like, I'll empty my bladder. But you have to talk to yourself and say, do I really need to empty my bladder? When we empty our bladder and we don't need to, we are teaching our bladder, not the pelvic floor, but the bladder, that we want to be notified that we need to pee when it's only a quarter full or maybe even an eighth full. A long time ago, I had a patient, and her goal was to extend the time period between voids because she and her husband were trying to drive to New Mexico. And so Colorado Springs, where I live, to the border is like, I think, 2.5 hours. And they literally had to rent an RV, or maybe they had one at this point, with a bathroom because she was having to go so often. So we put her on a plan where she was having to have like internal discussions with herself about, okay, do I really need to go to the bathroom? And we were able to extend the time because we really only want people to void every 2 hours if possible. So that leads us into urinary frequency. Do you feel that you're living in the bathroom? Are you going to the bathroom more than once every 2 to 3 hours? Are you getting up more than once at night to urinate? Do you avoid leaving the house because you're afraid you're going to find a bathroom? When you arrive at a destination, are you like trying to figure out where that bathroom is, or you actually go to the bathroom when you get there? Do you always use the bathroom before you leave the JIC, just in case? If you answered yes to these questions, your bladder is controlling you, and it is time to take control of your bladder back. And I know you can do it. So we're going to do some bladder retraining. So we need a bladder diary. We need to sit down and write down, how often are you going to the bathroom? The goal is really to void every 3 hours, especially if you're only having water. Now, if you're having coffee and those other things, everything's out the window with that. But how are we going to get to that 3 hours? What if you're at 45 minutes right now? Well, we're going to do the Kegels. We're going to get our Kegel, our pelvic floor muscle, very strong, so it will listen to us. So when we have that urge to go, we can do some Kegels to say, hey, not right now. I'm looking at my watch and it's not quite time to go. We can just cut out the bladder irritants, which I know is a tough sell. But if this is what you have and this is important to you, it is worth a try. And then we use the controlling the urge techniques, which is you get the urge, you breathe, you calm down, you stand still, you try some of the Kegels, you look at your watch, decide if it's time to go, and then you slowly get to the bathroom on time. Now, you have to be patient with yourself because I guarantee you will have some accidents leading up to this. But if you endure, I promise you this will help you. So this is an example of a bladder diary. I've got a couple coming up. So I don't measure stuff. I guess you could, but I've always done it with seconds. So I get up in the morning, I sit on the toilet, and the urine starts coming out, and I'm like 1 Mississippi, 2 Mississippi, up to 15 Mississippi. Because in the morning, you should have the most urine because it was storing it overnight, except that could also be dependent on when you got up at the night. And then, let's say at 6 o'clock, you have that coffee. I understand I'm a coffee addict myself. And then at 7 o'clock, or probably even sooner, you have that urge, oh my God, I've got to get to the bathroom on time. And uh-oh, I didn't make it, so I completely wet my outer wear. Then, let's say at 8 a.m., I just pee a little bit. And then at 9, I had water. And then I had a little urgency, and maybe I made it to the bathroom on time. You can use this technique, and I'm going to keep going here. Here's one that you can download from the National Continence Center to really look at, and it's got all the information on it. Don't worry about measuring. If you are using the seconds consistently, 1 Mississippi, 2 Mississippi, you can see how much you're voiding. If I'm doing this with a patient and they pee and then they stop, and then they pee and then they stop, I'll do like pee 3 seconds, comma, 6 seconds, comma, 2 seconds. And that's that inability to kind of empty, which is a whole nother topic. All right, so you can use that bladder diary to make a game plan. If you notice, coffee makes you wet your underwear. You may choose to be at home when you have coffee, or you might choose not to drink it at all. It depends what's important to you. If you notice, wine gives you a very strong urge and you cannot get to the bathroom on time, you may choose not to drink wine, or you make sure you're wearing protection. You're wearing a Depends and an extra pad, and you're like, well, I'm sorry, I want to have my 5 o'clock glass of wine and I'm going to do it. So you decide what's important to you and how you're going to plan for it. If you're noticing you're up 3 times at night, you might choose to limit fluids after 5 p.m. and increase those daytime fluids, because remember, we still want your urine to be clear because we don't want it to be dark and smelly and spasmy, because it's trying to protect you from an infection. If you notice you're going to the bathroom every 1 to 2 hours, you need to work on those urge suppression techniques so you can increase the time between voids. That's where you really talk to yourself and you look at your watch. And when you have to go to the bathroom and you think it's too early, you know, you go to the bathroom and you get there and you're like, oh my God, I had this terrible urge. And then I sit on the toilet and like 2 drops come out. That's when you know it wasn't worth it and you should have used the urge suppression techniques, or the coffee is just too much for you, or the wine is just too much for you. You're about to hear my clock in the background. I didn't think to silence that. If you leak a few drops with a cough or sneeze or change of position, you absolutely know the Kegel exercise needs to happen for you. And maybe you're lucky if that's it, because then you can drink your coffee and your wine and not worry about it. So you're really trying to figure out what the problem is. But I am not saying that you shouldn't be doing Kegel exercises, because a strong muscle is a healthy muscle, no matter what. Okay, the nocturia. This is what I learned about myself when upgrading this presentation for a lecture I gave a few years ago. Behavior modifications, decrease that nighttime fluid intake, decrease those bladder irritants at night. You're not going to have like a glass of whiskey or something at bedtime, because that's not going to suit you very well. You can also elevate your legs or put on compression stockings to redistribute those fluids. And when I mean bring your legs up, I mean above your heart. So you need your legs to be up if this is one of your problems. And then sometimes you just have to go with a management technique. Maybe this can't be fixed. So mattress covers, absorbent briefs, skin care products, because you don't want to get chafing and blisters and things that can lead to other yucky infections. Men, there's condom catheters. Women, now we have something called a Pure Wick. I've got it on my slide. It's one brand. It's expensive. It's like $500. But for some people, and insurance doesn't pay for it, it's worth it. It's like a sponge that lays in your panties right next to your vagina at the labia. So it lies right in here, and it doesn't go deep inside, it's really on the outside, and it takes that urine and it puts it to a little machine on the side of your bed. You might also be able to talk to your urologist about medications, but make sure you're talking to them, because if you're having coughing, sneezing, little bit of, urination with the stress incontinence from weak muscles, there ain't no pill to get stronger. It's just good old-fashioned hard work. Strengthening the Kegel. If there was a medicine to get stronger, oh my God, we'd all be on it. All right, now let's kind of switch gears about emptying the bladder. So it's important to empty the bladder. If you don't, you could get infections. When we sit on the toilet, we need to take our time. We don't want to push it out. We want to let it come out. I've got a picture of the squatty potty on the side here. It's not just for pooping, folks. If you look at where these muscles are, men too, you don't know it, but you guys pee better sitting down, and especially if your knees are a little above your hips. So if you don't want to buy the squatty potty, I've got the squatty potty in one bathroom, and then I have the little stool that my kids stood on to brush their teeth in the other. I actually prefer that one. But if your knees are above your hips, your pelvic floor muscles will open, so then your bladder can gently let the urine come out. If you think about people in other countries who squat to have a baby, I know you've heard about this about the bowel, but it's really the same for the bladder. So if you're struggling, like you get to the bathroom, oh my God, I have to pee, and then you sit down and you're like, what the hell? I can't even pee. That could be from bladder irritants. It could be from a toilet position. And you might try saying, ah, or row, row, row your boat, or just a sigh. When I worked with children who had trouble starting the flow, we'd give them those little blow horns that, when you blow and you exhale gently, very like your inhale to smell the flowers and then exhale to blow out the birthday candles, that can actually relax your bladder and let the urine, or relax the pelvic floor and let the urine come on out. All right, switching gears to organ prolapse, which is really special to women. We have so many special things. So if your bladder, uterus, or rectum are hanging low in the pelvis, they can put pressure on the muscles in here and decrease the strength. If I walked around and just something was pushing at my arm for like a year or something, that would weaken the muscles. So if your organs are lying on the pelvic floor, they are getting weaker. Prolapse can lead to something called incomplete voiding. This is back to the bladder diary where I said something like, oh, I peed 3 seconds, 6 seconds. And what's happening is you pee a little and then you change position and a little bit comes out. Then you get up and you're like, oh crap, you just peed all over yourself. And that's because that coffee filter, I'm not sure if that's being blocked out by my little video self on this presentation I'm doing for you guys, but that coffee filter is basically our bladder. And if it's being smushed because everything's lying on the floor of the pelvis, you can't get a nice funneling. It needs to be slung up again. And there are people out there that really do need to have a pelvic floor sling surgery to bring it up. If that's not an option for you, there's something called a pessary that's kind of like a diaphragm that goes up inside and helps kind of put all the junk back up there so that everything can be in a better position. There's sometimes if you can just feel it hanging in your panties, if you can put your legs up the wall, I wish I could figure out this camera to kind of demonstrate for you, but sometimes I'll have people lie on the floor and put their legs up the wall. It's actually good for swelling in the legs too. But all the bladder, the bowel, the uterus can kind of sink back inside. If you suspect this, I would definitely see your gynecologist, just so you know. And then with that, if you're going to do the Kegels, you must do them lying down, because if you're sitting, everything's resting on those muscles and you're not going to get a contraction. So if you're lying down on your side and even tilted up a little bit, then all the organs can kind of come back up inside you to give you a better shot at getting stronger. All right. In summary, you're trying to figure out, is it my pelvic floor or is it my bladder? If your pelvic floor is weak and you're leaking urine, you need to strengthen those pelvic floor muscles with a Kegel exercise. If your bladder is overactive, causing urgency and frequency, then you have to change your habits. I am so sorry, but you really do need to cut down on those bladder irritants and work on the bladder diary and retraining techniques. But all of us have to have good habits. We need to strengthen. A strong muscle is a happy muscle. We need to drink water. Your bladder loves water. Decrease those irritants, especially close to bedtime. Schedule. Your bladder loves a schedule. Try every 3 hours or less. Using those urge suppression techniques and retraining. Be nice to yourself. This takes time. Exercise every day and stay active to get to the bathroom safely and dry. We have to exercise so we can keep moving and grooving. Take control back. You have the tools in this handout to start taking control of your bladder so it stops controlling you. I have a little contact information here. You can email me with follow-up questions, and that National Association for Continence is an absolutely great resource. I hope you guys found this helpful today, and you guys can take control back, and you guys have a happy new year.